That is an excellent point, and putting in advance the list of companies that can react. That's a great. So we move on to David. David, and I think here the IFC experience, extensive experience on private-public partnerships is very relevant. PPPs is a very useful tool. Of course, it's not an easy tool to use, especially in countries which are poor, have weak institutional capacities. So the question is, what can be done to make PPPs more readily available? What kind of reforms, legal reforms, policy reforms can be done so that it facilitates PPP engagement and have something working and in place in case of helping out with pandemics?
Thanks very much. Those of you who, like me, thought that the lights which were on the desk yesterday had been taken away today so we could speak as long as we want. It's actually not the case. They're just down there underneath the screen. We can see them, but nobody else can. So, having used up the first 10 seconds of my 7 minutes. Thanks very much. Very nice to be here and to be part of this kind of panel. And as you've been talking, a lot of things have been sparked. So I'm going to have to adjust my notes as I go along as well. I think the point about public-private partnerships is, we want to get the private sector involved, but we need to get them involved in a way which is kind of contractually sound, and it gets the right sort of signals being pushed through. So let me talk first a little bit about a standard public-private partnership mechanism, and then I'm going to look at PPPs just from two angles, the local perspective and the international perspective as well, and from the international side to see where we can get local engagements facilitated. And I think the need to distinguish between this local and international level, Milan, you mentioned it yesterday, a little bit closer, yeah. Milan, you mentioned yesterday that there's a need to distinguish between these two levels. So a standard PPP, it's got a number of key features. It was originally in many countries conceived as a way of shifting debt off the public sector balance sheet through allocating risk to private sector. Now, the principle here was that risks should always be located in the places where they can be best managed. And this driving underlying principle led to a number of quite interesting outcomes. I think the shifting of debt off the public balance sheet was always a little bit of a smoke and mirrors activity, actually. But and it didn't really survive too close to scrutiny, but the principles of establishing really clearly defined, well-regulated, long-term contractual arrangements between the public need and the private sector provider has been something of a revelation. So the previous kind of standard agreement between a government that wanted to get a service or a good delivered, you issue a tender, a series of detailed designs, input specifications, it's a building, maybe it's a school, maybe it's a hospital, private sector goes away, comes up with a response to it, and they build it, they sort out the snags, and they walk away from it. What the public-private partnership model did was to focus on output specifications. So you tell the private sector, this is what we're trying to achieve. Now, if it's a school, for example, we want this number of rooms, they need to be kept at this sort of level of temperature over these sorts of periods of time. So you set out what it is you're trying to achieve, and you get the private sector to deliver in the most innovative and most cost-effective fashion. That's the first thing. The second thing is you lock them into a 10, 15, 20-year contractual arrangement so that what they build, they have to live with, and you get better quality out of that as well. That's an important element in this output specification approach on the public-private sector side. The understanding is the government will then pay an income stream, and that means that you've got the operations of the facility covered. Governments like it because it gives them service delivery with tight contractual conditions. Banks and financiers like it as well. They're given the chance to provide finance to private sector clients with a reliable income stream to support it. And the private sector is allowed to do what it does best, which is appropriate levels of control. The public sector the general public gets the private sector level service delivered off the back of a government funding stream. So that's PPP at its best, and it doesn't always work out quite as well as that in practice. I think the fundamental principles of it are sound. And it's been embraced in many areas, health, education, water treatment plants, and so on. So you get government and private sector locked together, performance standards set and delivery supported. So does it work in fragile and and poor states. And it does. IFC has helped in Lesotho. There's a government hospital there which has been replaced with a new hospital, 425 beds, and a range of clinics which feed into it. What does it need? It needs a private sector conducive operating environment. So World Bank runs its annual ease of doing business reports. Countries like Rwanda have made significant progress in actually improving their ease of doing business. And this is the counterpoint of the regulations which constrain. This is regulations which are meant to liberate. So people look at how easy is it to start a business, how to deal with construction, how easy is it to get electricity, registering property, getting credit, protecting investors, how does the tax system work, how easy is it to trade across borders, all of these things which make public sector people's eyes glaze over, but if you're in the private sector, it actually really matters whether you can do this or not in your business. So that's one thing. You need regulations which are conducive, orange lights. Governments are looking for advice in these areas. So setting up a PPP unit in a government, the idea is that it becomes like a one-stop shop. The risk is it becomes a one-more-stop shop. So you have to manage that side of things carefully. And using best practice, I mean, IFC has an advisory team which does do PPP advisory work, separate from the investment side. But there are other areas where you can get expertise to develop public-private partnerships. So regulatory change is actually feasible. I mean, we've done it. My team runs programs on the regulatory side in credit bureaus, collateral registries, and leasing, and it is possible to get regulations changed in African countries. We've worked in Ghana, Zambia, Malawi, Tanzania, Ethiopia, and Nigeria. Governments are keen to embrace best practice, and what we've found is that if a fellow African country has done something similar, that's much more effective than giving them advice from somebody with a PhD and an iPad. They actually like learning lessons from colleagues. So this is important, I think, because the paper that has been referred to a couple of times, Milan and Olga, it's the private sector which is seen as it's the public health sector which is seen as the weakest link in global cooperation against pandemic threats. And if we can use the private sector to help mitigate this risk, then I think we've got something really worth supporting. So I'm going to skip over the international ones because I'm about to run out of time. But the international public-private partnerships that we've talked about have been really crucial at the end of supporting what goes on the ground. So the Gavis, the IFM linked to Gavi, the global funds, these are all really significant suppliers of funds in a targeted fashion in the health sector. But in addition to that, we've got private equity funds that are able to support particular health-related operations. So there's an Africa Health Fund, IFC, the Gates Foundation, ADB, and DEG, amongst others, are involved in that. This is designed to help provide funding to allow the private sector health engagements to take place. And it's this kind of concept of incremental benefit. It's what allowed the Sky team to win the Tour de France. It's incremental improvements. And I think there are the big elements, but there's an awful lot of small on-the-ground development which is taking place, which is helping to improve the private sector engagement in the provision of the health services that are needed. So get the regulation right, get the funding available, and get the private sector engaged in a contractual obligation, and I think there's awful lot that can be done.
Thank you, David. There's a second question. It's not an easy one. Basically, the idea is we know that investing in preparedness and response is a very valuable, high-return investment. Poor countries can't really finance the investment, or they can't finance it totally. There is a gap. And the question is, can the private sector fill in that gap? And if so, what are the arguments to persuade the private sector to co-finance preparedness and investing in response?
Okay, thanks. So private sector, I mean, private sector is as varied as pathogens. I mean, it's difficult to talk about the private sector as a one-dimensional player in any game. I mean, the 1,000 flowers and bushes and trees are out there, already blooming out there. So let me talk in general terms first, and then I'm going to drill down to a couple of areas of particular interest. So can the private sector be persuaded to invest in measures to help the preparation and responsiveness? I guess this is an issue that hinges around that old statement that if my neighbor can't eat, then I can't sleep. So in a sense, here we've got the known unknown pathogens, and the unknown unknown pathogens means that we can't sleep. So the question is, can we rely upon the private sector to take on that public good role? No, not on their own. It's public goods territory. But as I tried to outline in the answer to the first question, there's a very strong case that can be made for public and private partnerships. Public money, public enabling environments, publicly shared information, but private sector ingenuity and innovation and efficiency and delivery. And that's what we should be looking to focus our efforts on. So that's a general point. I think areas drilling down a little bit, we heard data. We heard a lot yesterday about data. We heard about dodgy data and dubious data and delayed data and difficult data. I think we should focus more on digital data. Let me give you an example of what I mean. You may have noticed on your iPhone that when you're in your car, the road up ahead sometimes goes red on the screen. That's indicating traffic. That's not because there's some high-level spy camera up above watching the road, and it's not because they've got spotters on the side of the hill who are checking the traffic, or you've got someone who's listening to the traffic news and is feeding it into it. No, I think some bright spark figured out that most people have phones on in their cars, in their pockets or their jackets or in their purses, and so the system knows where the phone is. If your phone's traveling fast and suddenly stops, and a whole lot of other phones are traveling fast and suddenly stop, you've probably got a traffic jam up ahead. So this kind of way of pulling information out of raw data is something that we need to keep an eye on, I think. So I think we've heard some examples of the importance of the of digital financial services, but that's linked into mobile phones. There's an awful lot of mobile phone data, and this can be used in tracking of people. And I think in an Ebola kind of context, we should be really trying to work hand in hand with mobile network operators. I mean, this is their secret sauce in a way. They call data record information that they have. They don't like to share it. There's a lot of information embedded in it. But if we can come up with ways of engaging with them to help use that information in innovative ways to pull information about where people are moving and so on. I think Gates Foundation, along with one of our data specialists, Sven Harten, has been working on this as well. So that's one area. Digital financial services. You mentioned on the payment side of things, Daniel, how to pay workers safely. I think communication systems as well, how to get messages out through mobile phones is an area that could be looked at. I think if you focus on three things, I think, to create opportunities. How do you get the private sector involved? You create opportunities, and that's the PPP stuff we talked about before. The enabling environment is really important, and how to get it relatively easy for the financial sector and the private sector to operate. And then I think risk-sharing mechanisms. Now, at the local level, IFC, along with EIB, with some DFID money, has been looking to try to find ways to get funding available for small and medium-scale enterprises. And this addresses the point which Stacey raised about the economic impact earlier on. You mentioned it as well. How do you get funding available for the post-Ebola or post-pandemic period? So we've got risk-sharing facilities at a local level, and I'm just wondering if we can't take this one stage further in the context of a pandemic. I mean, it shouldn't be beyond the capacity of the key multilaterals in Africa, for example, which would be the World Bank Group, EIB, African Development Bank, to look at the loan portfolios they've got and agree a set of steps that they could put into action if you get into a situation similar to the one we found in Guinea and Sierra Leone and Liberia. So, I mean, it's to address the rather savage and widespread economic impact of these type of pandemics. So maybe a small but well-crafted set of steps could be triggered to provide some sort of relief on debt obligations for a period of time. And I have to tread carefully here because multilaterals don't reschedule their debt. But some sort of temporary relief measure is, I think, definitely worth looking at in the context of pandemics. And then we heard about this catastrophe drawdown facility yesterday, the CAT DDO. Natural disaster, you've got countries, the way it's structured at the moment, who are relatively well managed economically, and you have a plan to deal with the hazard and the impact of the hazard. But it's done on IBRD, so it's loan financing. But maybe we could take that and extend it a little bit further to look at ways of pushing grant funding through a similar type of mechanism so that you've got the reassurance that the money will be used for the sorts of purposes that are intended and the structures, and maybe you could channel grant funding through that as well. Because as we've heard, speed is of the essence. A dollar in this kind of context today is worth a huge amount more than a dollar in a month's time if you've got a pandemic stretching out. So one final point. I think one of the good things about engagement with the private sector is that it has this kind of restless search for doing things faster and smarter and better, because that's what you need to do to survive. And I think we need to try and capture some more of those sorts of approaches. I have one slide. I think the risk, if we don't do that, is that we stand still, looking in the same directions that we've always looked in, and we miss some of the kind of dangers or opportunities that